Thank you for taking the time to participate in this research study. Over the next few minutes, we're going to cover a few demonstrations that show us the best way to take care of our teeth and talk about the way cavities are formed and some of the ways that we can help keep our teeth throughout our life. Let's get started.
And now we're going to show you how to do the modified Bass method. Start at a 45-degree angle to the gums. That way the bristles get under the gums just a little bit. So this right here would be like 90 degrees going flat against the tooth, but see how the bristles don't get into the gums. And then this would be like 0 degrees. So you want to go at a 45-degree angle just like this. And then you kind of finish on a downstroke, just like that.
So we go ahead and floss. This tends to be the most preferred way. And what we'll do is you'll come down each side of the tooth. We'll start here and do kind of like a C shape to get down underneath that gum tissue. And then you'll come up on this side. It comes up. And then you'll actually go down on the other side, just making sure you get in between both of those teeth. This next version is mainly for your lingual bars. You either have one here on the bottom or you can have one here up top behind your teeth. They're usually placed after your braces. And to help with that, we go ahead and we just stick the little floss threader and it'll go underneath the lingual bar. And this will come through and this will help pull the floss through. So you can go ahead and kind of do that same like motion with your floss. Floss can come in any way that works best for you. This one is more like your floss pick and it just can kind of go in the sides. You want to come down over on that side and then move over, just kind of doing the same thing like we were showing before. And then there's this one that's kind of more for those wider spaces and things like that. I don't know, just kind of show up at this area, kind of little toothbrush. Kind of goes in between there and kind of brushes in between there.
Okay, one side and the other side.
So there's a common misconception that sugar is actually what causes cavities on our teeth, but that's not the case. What happens is we have little bacteria in our mouth and they eat whenever we eat. So if we eat something that the bacteria can also eat, then they're going to produce waste products in the form of lactic acid. Now, it's this acid that's actually going to affect the teeth by pulling the minerals out of the teeth. So the minerals that keep our teeth hard, like calcium and phosphorus, come out of the teeth and we're left with what's called demineralization. So this area of the tooth is now softer than it should be and is softer than the surrounding teeth. Once the tooth is demineralized, it becomes susceptible to caries or cavities. And that's exactly what happens once it gets soft. A little hole can form in the tooth, and now you've got yourself a cavity.
Certain foods and beverages can cause teeth decay, and we call those foods and beverages cariogenic. So some examples of those are different foods like caramel, chips, crackers. We have sports drink, soda, and juices.
ADA, the American Dental Association, it is recommended that we don't drink any soda, but if we're going to, then it is best to do it all at once instead of throughout the day, like doing little sips. These drinks can make the mouth more acidic and that makes your mouth more vulnerable to decay. If you're going to eat more of those cariogenic foods, then it's recommended to eat or to brush your teeth 30 minutes after you've consumed those things.
So hopefully we've learned today that taking care of our oral health is multifaceted. We've covered some different techniques today and talked about some ways that we can take care of our teeth, but everybody knows that knowledge is only as good as we use it. So we have some invitations for you. What we'd like you to do is start by brushing twice a day.
Sure.
Once you go ahead and clean between those teeth daily, and we want you to reduce the numbers of cariogenic foods or beverages that you consume each week by 2 servings. If you're anything like me, that can be a little bit tough, but with our help, we know you can do it.